Hello, my name is Jasmine, and today I'll be demonstrating how to insert an IV catheter into a patient's arm while also administering morphine for their pain. So my patient today, Mr. Scott Mingus, he is currently experiencing 8 out of 10 pain from his surgery. So today I have an order for him for 3 milligrams of morphine, which would actually be 0.3 milliliters of fluid into his IV for him. And yeah, we're gonna just hop right in and see how he's doing and explain the procedure. Okay. Hello, Mr. Mingus. How are you doing today? Not very good. I'm sorry to hear that. Well, I do have your medication with me here today. So I just wanted to pop in and, ask you about some of your allergies and tell you about the procedure. So can you tell me if you have any allergies, like to tape or latex or iodine? No? Okay, that's good. I didn't see any on your chart. So before I get started, I'm gonna check your name band. Can you repeat your last name and date of birth for me? Or your full name and date of birth? Okay, thank you. So I'm just going to explain the procedure a little bit. Today we're going to be inserting an IV catheter into your arm. It's going to be a little uncomfortable. You're going to feel a little pinch because there's going to be a needle, but it's not going to stay inside. And afterwards, you shouldn't be able to feel anything, okay? And then we'll put in that morphine for you. Is that okay? Okay, awesome. So before I get started, I'm going to raise the bed to an appropriate height, put them in low Fowlers, and give my patient the emotional support if needed. So we're gonna come over here. I didn't forget to say earlier, but I do have the medication here with me that I pulled from the MAR, and it is I'm going to be administering 3 milligrams of morphine, which will be 0.3 milliliters in the syringe that will be slow pushed over 1 minute per 0.1 milliliter. So 3 minutes in total for the entire push of medication. So, and I've confirmed that it's for the right patient. My patient, Mr. Scott Mingus, the right route, IV, right dose, 3 milligrams, right reason for his 8 out of 10 pain, and then the, right medication, right dose, yeah, okay. So, I'm gonna get started here. I'm gonna put on some clean gloves, and I have all my materials here with the appropriate catheter and catheter size. And first, I'm going to tourniquet my patient's arm, and then palpate for a vein. Okay, I feel one. So now we're gonna start scrubbing the site vigorously for 30 seconds. All right, good. So I'm gonna release the tourniquet. And while that's drying, I'm gonna prime my tubing and scrub the hub for another 30-ish seconds. So now I'm gonna let this dry. All right, and insert the flush of normal saline, and then unclamp my tubing. All right, perfect. So gonna reclamp, set that aside, and now I'm going to prepare to insert the catheter. So I'm gonna retie the tourniquet. Be careful not to touch the site that I just cleaned. Alright. So I'm gonna place a protective pad under my patient's arm. And then bevel up. We're gonna do double OK method. Open. Alright, and at like a 10 to 15 degree angle, gonna stabilize. We're going in. I see the flash of blood. Gonna advance a little further. And then advance the catheter. And then now I can screw this on. Perfect, perfect, perfect. Beautiful. How does that feel, Miss Mingus? Good? Okay, that's good. So I'm gonna throw this away in the sharps container and then kind of clear out my station a little bit here so that's less messy. Some of the trash off to the side. Still keeping my medication within sight. And then now before I place on the protectant, I'm going to write on the label my initials, the date, and the gauge of the catheter, which is 20. So, pretty sure, yes. And then right above the pink. All right. Right there. Perfect. All right. Now we're ready to flush. We're gonna do 3 to 5 milliliters of saline over 1 minute. Oh, well, we're gonna aspirate for blood first. And unclamp.
And it's the right time because she's getting every 8 hours and it's due right now in 8 hours. And the route is through piggyback. And I also checked, she doesn't have any allergies, but I'll double check as soon as I get there. So, right now, ready? Hello. Good morning. How are you doing today? My name is Becca. I am from St. Martin University, and I'm here to give you your antibiotic through IV. The doctor has ordered that, you're getting every 8 hours, and it's due right now.
All right, so we're about to be done with the first flush. So I'm gonna start preparing my medication. So I'm gonna start the second check right now. I'll leave this right here to flush later. Second check right now, I've got morphine here, which I will be drawing up 3 milligrams, which is 0.3 milliliters. That's mine.
This medication works really quick, probably in 15 minutes or so. So, and it might have some.
Seems I've lost my blood tip. Oh, there it is. Perfect.
Dizziness, so those are normal.
Alright.
If you have any, let us know. And if you feel dizzy when.
Alright, now I'm gonna scrub the vial for about 15 seconds.
Always let us know. So, are you consenting to getting the medication? Good. Okay, at this time, I'm gonna do my anti-hygiene and check after them to a good working heart. I'll check the IV side to make sure that it's going well. You're good right there. And how is your day going?
Alright, that's okay.
So far?
Now, double OK.
Alright. You have any pain?
Gonna wait for it to dry a little bit. Alright, it's dry, so now I'm gonna go in.
The IV side. Okay. The IV is intact. The skin around is healthy, looks healthy. It's not red or it doesn't have any rashes. It's not warm. Do you feel any pain check my medication and attach it to the primary.
Okay, looks good. So
Hygiene now. At this
now
point, I'll do the second, right?
I'm going to recap,
My patient is nearly
twist off, and then now our medication's ready,
500 ml.
and we're gonna flush again over 1 minute before I administer the medication. So yeah, second check, right patient, my patient Scott Mingus, right time, right now, right reason, 8 out of 10 pain, right route, IV, right medication, morphine, right dose, 0.3 milliliters. Just gonna administer close to the rest of this flush here. All right, so now we're gonna move this, and I am going to re-scrub the hub for about 30 more seconds.
Dry. Okay, it's been 30 seconds. So I'm going to attach my secondary here.
All right, gonna let this dry.
So then at this point, I'll do my lab check. So I have my patient immediately wrong.
All right,
Patient is
it's dry, so now I'm going to
ml.
do my third check right before administering the medication. Right patient, my patient Scott Mingus, right route, IV, right dose, 0.3 milliliters, right medication, morphine, right reason, 8 out of 10 chest pain, right time, right now. So I'm gonna push this over 3 minutes.
Now I'm gonna put try my secondary.
All right, Mr. Mingus, so while I'm pushing your medication, I'm gonna do a little bit of patient teaching, okay? So it's very important that you try and keep your IV site clean to reduce the risk for infection, and also since, oh, let's remove that. And also, it's very important to not take the catheter out yourself, because that would also put you at risk for infection. And if at any point you see your site leaking, or you feel pain, or you see the dressing come apart, please let us know immediately and we'll fix that for you, okay?
Even if you do planning, it's not gonna work because you're
Gonna use a pulsing motion
No, the 8.
to slowly push this medication.
do the back grinding.
Yeah.
Can you do that back grinding?
It
Now
won't-
I want to see your
It won't.
case stop. You want to do the back grinding? Back grinding is there. It's going, so it's not grinding.
But it's because I did stop.
What did you stop?
I stopped everything.
All right, I'm gonna throw away some of my trash here
I'm not going to do that.
Yeah.
So give me my sign then.
to clear my station.
The blue one is fine. And the one is-
Okay.
But you can.
You need it?
No, you can keep it.
Let me keep it.
I'm taking yours. I'm putting that back. I found. I am
All right, so we're hitting the 3-minute mark. All right, perfect. So now we're gonna unscrew this, then scrub it again for another 30 or so seconds so that we can flush, do the last flush over 3 minutes. All right, so just gonna let this dry. All right, it's dry, so we're gonna pop this in. 3 minutes. Same rate as the medication.
All right, fine. Are you ready?
Okay. Okay, well, just state in the video that in real life that you would start over. There's no. Oh, well, I would. Start over. Because I mean. I'm sure of that. Okay, thanks. Sorry, but. Sorry.
All right, so we're about to wrap up here. And I'm going to go and document that how my patient tolerated the procedure, and then I'm gonna go check up on them in about like 15 or so minutes when the medication should be kicking in to make sure that it's working. All right, so now I'm gonna remove this, and then tape the tubing away from the patient's hand. All right, and then I'm gonna take my materials here and clean up. And then, all right, Mr. Mingus, so I'm gonna come back and check on you. I'm gonna go document now, but then I'll come and check on you after, okay? All right.